Okay. Hello everyone. I'm Dr. Ram Prakash. Um, I'm working as an occupational physician with Apollo Life in Chennai. So today we'll be talking something about spine anatomy, and which will be followed by a yoga session by Ms. Sujita. So like past 2-3 months, we have been locked down, and most of the people take work from home. So you must be sitting for a long time, and we might have almost spoiled our spine. So the good thing with uh, that is, if you have got the spine problem like in a month or two, it is a acute problem which can be easily resolved by correcting your posture and start doing some exercises. So this is acute condition. So this is what we are going to address today. So we'll discuss some common back aches, spine related back aches, and followed by the remedy, like the flexible exercise will be taken care by Sujita. So shall we start the session?
Yes, everybody else is on mute, so I don't speak for everybody. We'll start.
Okay, so as we discussed, we'll be seeing about the spine and spine related problems. So what you see is what you're seeing here is a structure of the segment of the spine. So the spinal column is made up of 33 vertebrae piled up one over the other. We have 7 cervical vertebrae, 12 thoracic vertebrae, and 5 lumbar vertebrae, and 5 sacral vertebrae fused together to form a bone, and 3 to 4 coccyx vertebrae which fuses together to form coccyx. So each vertebra has their typical features. Like as you can see here, this is the cervical vertebra, and this is thoracic vertebra, and this is the lumbar vertebra. The one thing which you have to notice here is a vertebral foramen. So this is a hole in the vertebra. When you pile up 33 vertebrae over one or the other, you will form a canal within the vertebra. So this is where the spinal cord elongates from the medulla oblongata of the brain. So you can see here the cervical vertebra, thoracic vertebra, and within the vertebral foramen, the spinal cord runs through it. So this is where uh, the spinal nerves. There are 31 spinal nerves which arises from the spinal cord. So this is the foramen through which the spinal nerve comes out. This spinal nerve is responsible for all the motor and sensory neuration. So the touch you feel, the heat you feel over the skin, and the muscle, the movement of the muscle is all coordinated by this spinal nerve, which comes out of the vertebra through this foramen. So the next, between the vertebrae, we have a vertebral disc. So this is the spinal column which runs in the vertebral spinal foramen, and this is a spinal nerve which comes through the foramen, a hole in the vertebra through which the spinal nerve comes out, and then it supplies to the entire arm, leg, all the dermatomes and muscles. So in this picture, you can see, so basically spine is a S-shaped curve. So you can see two types of curve here. This is normal lordosis in the cervical region and in the lumbar region, and normal kyphosis in the thoracic region and in the sacral region. So this is the normal lordosis. The problem comes when we act against the lordosis. For example, what we do now is we use a lot of gadgets, like we bend the neck forward, that is against the lordosis, and then we text for a long time, or we used to play games in cell phone for a longer time. So that leads to text neck syndrome. So what exactly is text neck syndrome? This is not a disease, medical disease per se. This term was coined by a chiropractor practitioner in America like 3-4 years back. It's just a term. So what happens exactly in text neck is, when we use gadgets for a long time, by bending the neck forward, we give most of the strain to the neck, not to the whole cervical spine. If you consider this golf ball and golf pin, you can see if the golf ball is in the center, the golf pin carries away all the weight. But if it is placed in the tip of the pin, then you can see what happens. So this is exactly happens this is what exactly happens in the text neck syndrome. Actually, our head weighs around 4.5 to 5 kgs. If you're seeing, if your head is 0 degree to your body, then the 4.5 to 5 kg weight is, the force is entirely diffused. It's scattered throughout the cervical region. But if you bend 15 degree, then the force exerted on cervical spine rises to 12 kgs. So if you bend for 30 degrees, the force exerted on cervical spine is 18 kgs. So if you bend throughout like 60 degree, the force exerted on cervical spine is 27 kgs. So there is where we get the problem. So what are the problems with text neck syndrome is the pain in the neck, upper back, and the shoulders. So most of you, if you have watched the movie in the mobile, or if you had played PUBG for hours in the mobile, then you would have felt this pain in the neck or upper back or shoulders. So over a long time, if you have been doing this for a long time, then you will find you will face the reduced mobility problems, like reduced mobility, headache, because the muscles in the upper back, the muscles in the neck and the upper chest, those get what to say, stiffness. So again, if you bend again, if you flex the neck again, you will have increased pain. This cervical radiculopathy is nothing but the nerve which comes out of the cervical vertebra gets pinched. So once you get that, you will feel all the electric shock sensation throughout your arms, or your tingling sensation, or the numbness throughout the hands can be faced because of the text neck syndrome. That is called cervical radiculopathy. So how do you prevent this? So to prevent this, you need to raise your phone to your eye levels. Do not bend your neck. Do not flex your neck too much, so that you don't give the strain to the cervical vertebra. So raise your phone to your eye levels. Take frequent breaks, because you're not only relaxing your muscle, you're not only stretching, but you're taking off the strain of the muscle. So that's important to give very frequent breaks in between. So stand up frequently, stretch your arms, stretch your neck, arch your bodies so that your muscles get relaxed, and then exercise regularly. So these are few exercises which you can see to stretch your neck and shoulder. Then as we said earlier, there is an intervertebral disc which is placed between the vertebrae, all the 33 vertebrae. We have an intervertebral disc placed in between. So this intervertebral disc has two parts. One is the central part, the central nucleus part, which is a gel-like substance, and the outer annulus part. This is a hard substance. It's like a hard rubber. Okay, this is sensitive to the pain. So the outer annulus part is sensitive to pain, and it is harder. And the inner nucleus part is gel-like substance. But the main characteristics of this nucleus pulposus is it can stimulate a inflammatory reaction. For example, if it touches something, then it causes inflammatory reaction. What is inflammatory reaction is it starts irritating the parts which it touches. So this is the main characteristic of nucleus. It initiates inflammation. So this is the main important function of the intervertebral disc. The intervertebral disc acts as a shock absorbent. It is like a spring, because the vertebral should not rib together, right? So the main function of this intervertebral disc is to take off the shock from the bones. So it basically does this job. It gives flexibility to the spine while you walk or run or play. So this is the main function of the vertebral disc. So this is the innermost gel-like substance, and this is the harder outer part, nucleus part. So there are some problems which arises over time. That is called disc degeneration. So you can see a number of problems which arises. So this is a bulge disking. This is herniated disc. This is a degenerative disc, and this is thinning of the disc. In the bulging disc, what you can see is the inside gel-like part bulges outside due to the pressure. There are various causes. We'll discuss that. And the herniated disc is the inside part, the gel-like substance breaks out the outer nucleus part and then flows out of the vertebral canal itself. So this is a degenerative disc. the disc get degenerated over time because of just like warning out. So thinning of the disc is the disc get thinned out. So there are various causes for it. The drying out of disc is one of the main reason. So during our birth, there are we have 80% of water in the disc. So as we age, the water content in the disc reduces. So the flexibility of the disc. So it gets worn off. It get degenerated. So and also the daily activities and sports we play. So that also degenerates the disc, and also the injury, age factor, everything contributes to the disc degeneration. Also the poor posture, also this repetitive strain injury when we sit for a long time in a poor posture, that also contributes to disc degeneration. So what is the common symptoms? Symptoms is the pain that is worse when sitting. So when you are sitting, the pain will be more because when you sit, you exert more than 3 times than standing. So the lumbar vertebra gets more strained. It gets 3 times strained while you are sitting. So the pain gets worse when you bend or lift or twist. So always you feel like walking or even running. You feel like running than sitting. So it also leads to numbness and tingling in the extremities. So that happens when the herniated disc, when the disc herniates. So as I said earlier, this is the disc between the vertebra. This is the outer part, and this is the inner part. So what happens in the herniated disc is the outer part breaks away, and the inner gel-like part goes out and stimulates the nerve. It pinches the nerve. It pinches the nerve which goes through the foramen. So this is what we call as sciatica. When the sciatic nerve is pinched due to the herniation of the disc. So you can see the lumbar vertebrae here. All these are lumbar vertebrae. This intervertebral disc, and this disc gets herniated, and it is compressing the sciatic nerve, which is coming out of the lumbar vertebra. The sciatic nerve is the one which runs from the lumbar vertebra throughout the leg. So you can either feel pain in the either you feel the pain or numbness or tingling sensation or electric shock sensation. So it depends upon person to person. But for few people it affects only till the butt. For few people it affects till thighs. Few till calf. So the symptoms may be different, but the process is the same. It's due to the herniated disc. Sciatica is sciatica is an acute condition actually. It goes away within a weeks or months by correcting your posture. But if you feel a loss of bowel or loss of bladder function, or if you feel any muscle weaknesses, then it is time to get treated with surgery. So far we have seen with the vertebral discs, and now we'll just see the problems faced in the vertebra itself. So one condition is called spondylosis. The spondylosis is nothing but the vertebrae, the gap between the vertebrae decreases, so that it pinches the nerve which comes out of the foramen. So that is called spondylosis. Even this leads to facet syndrome. Facet syndrome is nothing but okay. This is the vertebra. There's one joint called facet joint. This is the place where it gets interlocked. The vertebrae get interlocked. Okay, so there is if it can lead to arthritis of the facet joint as well, the spondylosis. And there is a term called spondylolysis. This is an anatomical defect actually. So what you see is here is a vertebra, two vertebrae placed one or adjacent to each other. And this is a small segment of the vertebra called pars interarticularis. So in this condition, in the condition called spondylolysis, there is a breakage of pars interarticularis. So what this breakage can occur in 5% of the population. So mostly this breaks occurs in L5 of the vertebra. So this minor fracture is mainly due to the repetitive strain injury. If you're continuously doing something, or if you're sitting for a long time, if you're riding your bike for a long time, so it is a minor crack. Most of the people doesn't even feel any symptoms when they have a minor crack. Okay, but it almost have 5% of the population gets affected by this condition, spondylolysis. So when this weakens, when the spondylolysis weakens, it leads to spondylolisthesis, which means the vertebra itself gets displaced from the vertebral column. So this is some serious condition. 15% of the spondylolysis patient leads to spondylolisthesis. So this mostly occurs like in the trauma, mostly because of the trauma, or if if this weakens so much, then it's lead to spondylolisthesis. It is more common in women actually. So there are 4 grades in spondylolisthesis. This is a normal spine where you can see the intervertebral disc is placed exactly in the middle. But in grade 1, there is a 25% slippage, and grade 2, there is 50% slippage. From 25 to 50%, you can see the vertebra is displaced. Most of the people will have severe pain in the grade 2, so they get treated. It's very hard to find grade 3 and grade 4. Only in traumas we see this grade 3 and grade 4. So if you have 75% slippage, then it will look like this, and grade 4 is more than 75% slippage. So other condition is called spondylitis. This is very common, like what we say in knee osteoarthritis. It's just like a osteoarthritic spine. So it is a degenerative problem. So the disc get worn out, the bones, the vertebral body gets worn out. So it become the bony spur starts popping out. So this bony spur starts irritating the nerve which goes along the foramen. So you can find, you will feel this radiculopathy pain. And one more condition is called coccydynia. So coccydynia is inflammation of the tailbone. So we have a bone called coccyx. As we discussed, the 3 to 4 bones fuse together to form coccyx. This coccydynia is a condition where this coccyx bone is inflamed. The main cause is due to cycling or most repetitive, any kind of repetitive activities. Even the IT software people who sit for a long time, even doctors gets this problem, coccydynia. And few after women faces after childbirth or any abnormal movement of coccyx leads to coccydynia. So the prevention is only thing, you need to give very adequate breaks. You need to stand up, walk for a few minutes to prevent coccydynia. The treatment is just simple. You need to let it heal. It takes around like a week to heal. So you need to be on complete bed rest. You can also use coccydynial pillow. There is a pillow called coccydynial pillow where it's the pillow is designed in such a way that the coccyx is not pressurized at all. So people can use that to get rid of it. So other common causes includes trauma. Uh, so any trauma can lead to breakage in the disc, herniation disc, or it can affect the vertebral column. And infectious diseases such as POTS disease, TB can sometimes affect the spine. We call it as spot spine. And a few autoimmune diseases like rheumatoid arthritis or even HLA, ankylosing spondylitis, also can cause. In condition called ankylosing spondylitis, there is a degenerative problem in the vertebra, and then after degeneration, the vertebral column fuses together. So it forms a bamboo. If you look at the X-ray of ankylosing spondylitis patient, it will be just like a bamboo stick. So the vertebra fuses together due to the degenerative process. And then the muscle strain. Muscle strain should not be ignored, because most of the time people suffer from muscle strain, especially in the lower back region. So how do you differentiate from muscle strain, muscle spasm, and herniated disc or spinal problem? See, the muscle strain or muscle spasm is very, very localized. So you won't get pain in the center of the spine. It will be always adjacent, either left or right side of the spine. So the muscle spasm will be always localized. You can see the warmth over the pain region, or if you touch it, or if you press the muscle, you'll get pain. And unlike this vertebral problem, unlike this disc problem or vertebral problem, the pain due to muscle strain will not be radiating to the back or radiating to the legs. mostly it might radiate to buttocks in rare cases. Otherwise the pain will be mostly localized. So and then the pain usually worsens if you walk or if you move. But if you rest for sometimes, or if you give cold press, cold therapy or ice therapy or heat massage, you will get instant relief. So you can find then you can conclude that it is a muscle strain. um, the other thing is, the other common cause is osteoporosis. So osteoporosis is a condition. See, all our blood maintains calcium levels. Okay, so our body consists, like it consider bone as a storage for calcium. So whenever there is a reduced content, whenever the blood calcium level lowers, then the body automatically takes the calcium from the bones. So always you need to always maintain your blood calcium levels. So when the calcium levels lowers, the bone gives its calcium to the blood. So what happens to the bone? So it becomes brittle without the calcium blocks. So that can lead to minor fractures, repetitive strain injury, etc. So that always gives you a pain. So lack of exercise. um, if once you regularly exercise, you always relax the muscle as well as you're removing the strain. But if you don't exercise, then the muscle itself causes the strain, especially the muscle which supports the spinal column. So again, obesity is the main reason for the lower back pain. So as you can see in the picture, so this is not the normal lordosis. This is exaggerated lumbar lordosis. See, the normal lordosis curve should finish here only, but it is exaggerated lumbar lordosis. So that's why it is extended more because of the load in the tummy. So what happens exactly is the load on the spine is more over this region. So that's one reason for causing the pain. The other reason is the facet joint. The facet joints get arthritis. We get arthritis of the facet joint, and also the load on the facet joint increases. So it might lead to spondylolysis, where it can break this part can break, as we saw earlier. And also, as you can see in the picture, if the regular load is placed over the vertebra, then the center of gravity should be in the center, right? So once there is an exaggerated lordosis, you see where the pressure goes. The pressure shifts to the left, so which leads to compression of the intervertebral disc. Later, it just gets herniated. So that's one main reason. And the other reason is the poor posture. So we sit for a long time in the poor posture. We lie our bed. We keep our gadgets with us. So the posture is totally different. So always you need to keep once you're going to sit for a long time and work, or you play or watch a movie, you need to always take care of your posture. So one thing is, how this is a model of the workstation. If you're sitting for a longer time, if you're doing some desk job, then you should always keep a look at it. So your top of your screen should be at your eye levels. So make sure your shoulders are relaxed and your forearms are placed parallel to the floor. It should be placed over the armrest, or it should be placed over the desk. And then no chair fits to everyone. So because of the lordotic curve, as we saw earlier, there's a curve in the lumbar region called lordotic curve. So this backrest should support the lower back. You need to choose such a chair, or you need to adjust the chair accordingly, like your lower back is supported by the backrest. And then your full thigh should be placed completely over the seat rest, and then your leg should be bent in a 90 to 110 degree angle. Either you can keep it here or you can extend till here, but your feet should always be flat on the floor. So even your sleep portion should be proper. As you can see, the firmness of your mattress should not be too hard or too soft. If it is too firm, then you can see how the spinal curves is irregular. And if the mattress is too soft, you can see how the spine bends. And what ideal fairness should be this one. Like it should not be too soft or it should not be too hot. It should be ideal so that your spine is so straight, so you don't strain your spine. So just like this, the correct sleeping position. So this is the incorrect sleeping position. This is the incorrect sleeping position. So don't even strain your spine even during the sleep. So as we discussed earlier, the maintain bone health is very important. So to maintain the bone health, you need to consume rich calcium-rich foods like milk, yogurt, cheese, and paneer, ragi, and green vegetables like broccoli, spinach, and methi. You can consume egg, chicken, fish also for rich calcium. Nuts like almond and peanuts also contains high amount of calcium in it. So calcium without vitamin D cannot be absorbed properly by the body. So vitamin D is also very important. As you know, the dietary source of vitamin D is very less. Like only egg yolk and fatty fish have minimal amount of vitamin D. So what you can do is the most vitamin D is produced when you are exposed to the sunlight. The skin has the capacity to produce vitamin D. So the skin produces vitamin D only when it is exposed to the sunlight. So don't get exposed to sunlight in the dawn or dusk. You should get ideal exposure should be around at least 20 minutes. From if you are exposed in the morning, best time would be from 9 to 11, and it would be like 3 to 5 p.m. in the evening. So that's the best time to get exposed to the sun for ideal vitamin D secretion. So the other preventive measure can be to have your lower back flexible. So you should focus on your lower back. So these are few exercises which you can do. You can take a look at it, like standing hamstring stretch. You are stretching your hamstrings, and so quadruple the arm or leg rise. This is a side plank, and this is gluteal stretch. This is cat camel, the pelvic tilt, the partial curl, and this is the extension exercise. So what's the take home message? So always look at your posture. So most 60-70% of the problem can be prevented, and even if you're in acute condition, 80%, 90% of the problem can be reverted once you correct your posture. So always correct your back posture, proper sit in a proper chair with the proper lumbar support, and also neck posture. Be aware that you're flexing your neck way too much. When you flex way too much, you're exerting more force over your cervical vertebrae, the cervical spine. So give adequate rest. Keep your mobile at the eye levels and use. And the next thing is the bone health. Do not ignore bone health. The calcium and vitamin D are very important. And exercise, yoga, combination of exercise, yoga, walking, jogging, everything strengthens your muscular and skeletal system. Okay, so thanks for joining. So I think uh, anything else? Any questions? Or Sujita, can you take over?
Yeah, sure.
Anything? Yeah.
Guys, if you have any questions, just type it out immediately. Otherwise, we'll start off the session.
Yeah, okay, no problem. Even if you have any questions later on, you can always email to this ID. I'm dropping the email address here.
Awesome.
So I'll also send out, roll out an email after the session. So it will contains like some few bullet points which you should be following to prevent from the lower back pain, everything. So if you haven't given your proper email ID, you can drop it down here. I'll add it. Yeah, I think Suji can take over.
Alrighty, done.
Thank you guys
Guys,
so much.
thank you so much, Ram. I learned a lot myself.
I'm glad.
All right, guys, for this next session, I would like all of you to turn your videos on. Let's see all of your beautiful faces and the space that you have set up. So the next one is going to be a very short session on yoga. So we will do a session on yoga, but this is primarily based on mobility. Mobility based yoga is what we will do. So it's not like a regular yoga session. I will also call, right? We have a question, Ram. All right. So we will start off, and towards the end, maybe Ram can address that. Okay. Good evening, guys. I'm Sujita, and I hope you have your space set up. We will begin. So we will, as always, start off in this posture called Sukhasana or Siddhasana. Okay, so in your laptop or your mobile, have the speaker view on so that you can see my screen, and it's, you know, it should not be like a small one. You have to see and you can replicate what I do. Okay, so you'll have one leg in. So in normal seated posture, this is called Sukhasana, and the other one leg in. You can place the other leg right beside it. This one is called Siddhasana. Okay, whatever works for you, just sit comfortably. As long as you're comfortable, you're good to go. Okay, guys, I would request you all to turn on the videos so that I can see all of you and offer correction if needed. So place your hands on your knees. Sit up really tall and maybe close your eyes for a bit. Take a moment, just tune in all our focus to our breath. Take about 5 breaths together, and then we will begin the session. Okay, sit up really tall, spine straight. You're having like the natural S curve that Ranju spoke about in your spine, but you're still sitting erect. Your hands placed comfortably on your knees. I will be teaching you a technique called the belly breathing, right? Belly breathing is nothing but the breath wherein we are going to breathe from the stomach and all the way up. So as children, if you see, when they lie down, you find their stomach rise and fall on every inhale and exhale. Okay, over time, what has happened is we have started breathing really shallow breaths. Okay, so now we will use this time to really engage and breathe from our belly all the way up. Okay, so if you are not sure about the movement, you can place your hands on your stomach. Right? So we will start off with just about 5 rounds of belly breathing. Okay, take a deep breath in. On the inhale, let your belly go out. Expand, fill up your lungs. On the exhale, slowly squeeze your stomach towards your spine. Exhale, squeeze it in as much as you can. Inhale, belly expanding, fill up your lungs. It's called a 360-degree breath. Exhale, draw the stomach in towards the spine. 3 more to go. Take a deep breath in. Inhale. Slowly exhale, release it out. Last 2, inhale. And exhale, slowly release, squeeze the stomach in. Last 1, take a deep breath in. And become bigger. Exhale, slowly release, squeeze the stomach in towards the spine. Right? This is called the belly breathing or the 360-degree breath, where increase that breath, increase the intensity of the inhale and the exhale. So that's what we're trying to do now. Right. Now we'll start off with some seated stretches. Okay, I see most of your videos are off, which is fine, but I hope you're doing it. You will not be able to feel the difference unless and until you do it along with me. Okay, so just play along and do it at your space. So we'll start with some seated stretches. Take your hands by your side. Okay, and ensure that you're sitting tall. You're rolling your spine, shoulders back, hands on the side. Okay, on the inhale, reach away. Imagine somebody standing on either side and you're trying to reach them and up. Exhale, bring it down. Reach away again and bring it down. And a little behind. Two more like that. Inhale, reach out and up. Big breath in. Exhale, bring it down. Release. Last one. Inhale, reach out and up. Stay there. Hold, stay, reach up. Feel your ribs flaring open. Hold for 3, 2, 1. Now we go into a side bend. Okay? Place your left hand down. Remember, your knees are going to be just where they are. And reach your right hand up and across. Stretch. Slowly reach up. Go over to the other side. Right hand down. Left hand reaches up and across. Get a stretch. Right? We're doing this 2 more on each side. Reach up. And stretch. Left hand down. Right hand reaches up. Reach up. Right hand down, left hand goes up and up. Last time on each side, slowly reach up. Right hand down, left hand down, right hand up. Alright, once you've reached like your maximum, I would like you to bend your arms to a 90. Open your chest out, look up at the ceiling. Very small shape, but you will feel it in your body. Hold for 3, 2, 1. Slowly extend. Reach and we go to the other side. Okay, same thing on the other side. Right hand down, left hand goes up and across. Get a stretch. Cactus your arms, bring it to a 90. Open, look up. Good. Stay here for 2. 1. Slowly extend and bring it down. Bring it down. Okay. Now we're moving into twist. So basically, the spine has the following movements. You're going to round your back. This is called flexion. Open your shoulders, arch behind, extension. And then you have the side, lateral flexion. You move sideways and then you twist. This is the primary function of your spine. And we will do all of that today, including in this mobility. Okay? So next is we are going to do the twist. So place your left hand on your right knee. Take the right hand behind. Look back. Remember, your shoulder should be directly over your hip. Don't shift back. That's the usual habit. Don't shift back. Look back. The farther you look, the more you twist. Hold for 3, 2, and 1. Slowly release. We do the same thing on the other side. Take your left hand behind, right hand on your left knee. Look back. Twist up really tall. Twist there for 3, 2, and 1. Slowly release. Slowly release. Now place your hands on your knees. Okay. Now I'm just going to turn so that you can see me. We're going to do some seated cat and cow, we call it. I'll show you the actual cat and cow as well. This is the seated one. So place your hands on your knees. When you exhale, you're going to bring your shoulders together, round your back. Shift your weight back. Go back till you feel that, when you let go of your hands, you're going to fall off. Go back. On the inhale, shift forward. Roll your shoulders back. And you look up. You'll feel the contraction behind in the back. 2 more like that. Exhale, round, shift away. Round your back, look towards your spine. Look towards your stomach. Inhale, shift forward. Roll your shoulders, look up. Last time. Exhale, round, shift away. Inhale, shift forward. Roll your shoulders and look up. Into a neutral spine. Neutral spine. Now, we're just going to do some, one mobility for the shoulder and for the neck. Okay. So I would like you to interlace your hands like this, but behind. Okay, take it behind. Yes, good. Roll your shoulders back. Okay, feel the shoulder blades meeting behind, and you look up. Stay there for 3, 2, breathe, and 1. Slowly, just look in front. Your hands are still interlaced behind, but you're just looking in front. Okay. Now keep looking at the monitor, but you're just going to bend towards your right. Till you feel that stretch on the left side. Yes, good. Stay here for 3, 2, and 1. Slowly bring yourself to center and to the other side, bend. Till you feel that stretch, hold for 3, 2, and 1. Slowly release. Place your hands on your knees. Right? Now we're going to do a couple of neck circles. Okay, so bring your chin to your chest. Slowly take the chin over to your right, your chin to your right shoulder, and then you turn, bring your ear to your right shoulder. Looking in front now. Okay, now draw a circle, open it up, bring your left ear to your left shoulder, turn, and then you bring your chin to your shoulder now, and then your shoulder to the center. Right, we'll do this again. Do this along with me. We'll do this other side, okay? So chin to chest, chin to the left shoulder, left ear to the left shoulder. Yes, good. Open, draw like a circle, big circle. Right ear to the right shoulder. No, taking the shoulders in the same position. Chin to the right shoulder, and you come down. Slowly, neutral. Okay, so these are some exercises that you can do even at your desk. So one more thing for the neck. Okay, so as Ram told, we have a lot of this neck situation wherein we bend all the time. So one exercise that we can do to help strengthen those muscles is called the deep neck flexor exercise. Okay, so here you're going to look straight. I'm turning so that you can see me. Just going to look straight and bring your chin back. Bring just the neck back. Imagine you have like a wall behind you and you're trying to place your reach for your head behind. Okay? No looking up or down, just straight. You should get like a double chin like I'm. Slowly release. We do 5 of that. Exhale, bring it in. Inhale, release, relax. Exhale in. Inhale, release. Exhale, bring it in. Inhale, release. 2 more. Exhale, bring it in. Inhale, release. Last one. Exhale, bring it in. Inhale, release. Sandhya, you're looking straight. You should not look up now. You're looking straight and then you bring it back. Can you do that? Yes. Can you keep looking straight? You're tilting your neck up. Don't tilt your neck up. Ah, yes. Perfect. That is what you're doing. Forward and back. Just that cheekily. No, no. Don't tilt. Don't tilt. Back. Back. Yes. Better. Better. Don't tilt the neck. Okay. My neck is still here only. I'm just shifting back like you would do in your dance. Right? Shift back. Get the double chin. Release. No up. Just try. Alright. So we'll move on to the next ones. These are some seated postures that you guys can do even while sitting on your chair in front of your system. Any given time, take like a half an hour break. Break every half an hour and do this. Okay, so the next one, you're going to come into all fours. All tabletop Barmanasana in Sanskrit. So all fours, the fingers are going to be spread wide. Your shoulder will be over your wrist. Your hip will be over your knee. Okay, your spine is neutral, is straight. Okay, so from here, we're moving into a couple of rounds of cat and cow. which is really beneficial for the back. So on your exhale, you're going to round your back, shift away from the floor, and look down towards your knees. Okay? On the inhale, slowly drop your hip down, drop your stomach down, your abdomen down, roll your shoulders, look up at the ceiling. Okay, you'll feel like contraction behind. We do this a couple of times. Exhale, round, shift away, look towards your knees. Inhale, drop, roll your shoulders, and you look up. Right, 2 more. Exhale, round, shift away, towards your knees. Feel that expansion behind Buddha Blush. Inhale, drop, roll your shoulders, look up. Last one, exhale, round, shift away, towards the knees. Last one, inhale, drop, roll your shoulders, and you look up. Come into a neutral spine, spine is straight, hug your stomach in, come into neutral. Okay, now take the left leg behind. Take the left leg behind, steady your hips, and reach the right hand forward. This is a spinal balance that Ram had shown. We'll do that. Stay here, really engaging the stomach, strengthening every part of your body, all the way from your toes to your fingertips. Hold for 3. Steady yourself for 2. And 1. Now slowly drop the right hand down. Right hand down. Bend your left knee to hover. Okay, so this bit that we are doing is going to help your glute muscles, okay, your back muscles. So what you're going to do is, remember nothing else is moving. Just take the left knee up. Okay. Now open your hips. Take the left knee to this side. You'll feel the pain. And then slowly bring it down. We'll do this 2 more times, okay? So take it up. Open your hips to the side and down. Last one. Take it up. Open to the side and bring it down. Nothing else is moving. Now take the same knee, the left knee, to the side. Take it back. Bring it down. 2 more. Take it to the side. And down. Feel the burn last time. Take it to the side. Up. And down. Release. Okay. Now we're going to do the same thing on the other side. So extend the right leg behind and your left leg in front. Hold. Really engaging through the stomach muscles. Stay. 5, 4, 3, 2, 1. Drop your left hand down. Okay. Bend your right knee. Yes. Take it to the side. Open your hips. Bring it down. 3 on this side, right? Lift up. This is 2. Take it to the side and down. Last one. Lift. The side and down. You're doing the same thing on the other side. Take the knee to the side now. Back up behind and bring it down. 2 more. The right. Take it to the right side. Lift up and down. 1 to the side. Up and down. Relax. We'll move into 1 round of cat and cow. Okay. Inhale. Drop. Roll your shoulders. Look up. Exhale, round, shift away, and look towards your knees. This is called a cat. Come into a neutral spine position. From here, we're going into an asana called the Anahata Asana, and that is to stretch the front portion, okay? So what you're going to do basically is walk your hands farther away, as far as you can reach. Okay? And now bring your forehead to the floor. Yes? Yeah. Right? Maybe with time, you might be able to bring your chest as well to the floor. This is a heart opening posture. Stay for 3, 2, and 1. Slowly look forward, rise up, walk your hands back. Okay, now we're going to lie down on our stomach. Okay, so slowly shift your weight forward. Drop your hips, drop it down. Okay, place your forearms on the floor. I hope you guys can see me. You're going to place your forearms on the floor. Fingers spread wide, hands on the floor. Look forward. This is called the Sphinx pose. This is again really good for the back. Okay, stay here. Yes, good. Look forward and stay. 5. If you're feeling any strain, you walk your elbows forward. Well, you can relax that way, or if you want to increase the stretch, walk your hands back and lengthen up. Wherever you are, we're here for 3, 2, and 1. Slowly release. Release. Now, what you're going to do is, this is again for the upper back. Okay, so you're going to place your hands by your side. Okay, imagine a capital T position. So I'm just going to sit up. You are going to lie down on your stomach. You're going to place your hands like a capital T position by your sides. Okay, imagine you're doing like a thumbs up with your thumb facing up. Okay, once you're there, lift your hands up. Once you're there, lift your hands up. Your forehead is on the floor. Lift up as much as you can go and bring it down. Trying to open the chest here. 2 more. Lift up and down. Last one. Exhale, lift up and down. Okay. So the next one is you're still going to lie down and you're taking your hands to to a position like this. You're forming like a Y with your body. So again, thumbs have like a thumbs up position with your thumbs facing the ceiling. Right? From here, your forehead is again going to touch the floor and you're going to lift your hands up. Let's do 3 of that. Hands forward, capital Y. Lift up and down. 2, lift it up and down. Remember your forehead is on the floor. Last one, lift up. Down. Alright, so the next one is that your hands are going to be parallel to one another in front of you. Okay, hands are going to be parallel to one another in front of you like that. Okay, and then from here, forehead is again coming to the floor. Lift up. This is probably going to be more difficult than the others. Lift up and down. We go for 2 and down. Last one, lift it up and down. Right. Slowly walk your hands back. Now, this is going to get into a shoulder stretch. So, extend your left hand straight. You form like the capital T at the beginning, right? Extend the left hand straight across. Now, just going to look to the right, roll into that shoulder, and take your right leg, place it outside your left. You'll feel that stretch in the shoulder. Stay here. Bring your head down. Here for 5, 4, 3, 2, and 1. Slowly bring the leg down. Release the hand. Okay, so we're going to do the same thing on the other side. So adjust yourself. Extend your right hand across like a half capital T position. Roll over. Look to the left. Place the left leg outside the right hand. Right leg. Head comes down. Stay. Reset. Breathe. Here for 5. Breathe for 4. Stay for 3. 2. And 1. Slowly release. Release. Bring yourself Again, flat on the floor. Place your hands by your ribs, okay? A little bit beneath your chest. Bring your elbows together. Let it frame the body. Inhale, roll your shoulders and lift up. This is called Cobra or Bhujangasana. Lift up, palms on the floor. Lift forward. Lengthen up. Take here for 2 and 1. Slowly bend your elbows and come down. We do 2 more like this, okay? Inhale, roll your shoulders, lift up. Exhale, slowly bring it down. Take your time in all of these postures. Last one, inhale, roll, and lift. Stay here, 2 and 1. Slowly shift your weight back. Now take your knees wide. Place your knees as wide as your yoga mat. Okay? Bring your feet together. Place your hip on your heel. Walk your hands forward. Bring your forehead down. This is called the child's pose or balasana. Try to place your hip on your heel. Yeah, good, Abhilash. Stay there. For 5, 4, 3, 2, and 1. Now, slowly shift your weight forward. Bring your knees as wide as your hips. Right? Tuck your toes. Walk your hands a little in front. Lift your knees up and down. You're forming like an inverted V position with your body. This is called downward facing dog. Shift your hips back. Maybe bend one knee and then the other. Wriggle it up. Let your fingers be spread wide. There. Breathe. Maybe stay still. Maybe move your collar. Getting a nice stretch behind. Here for 2. And 1. Slowly look forward towards your hands and make your way to the top. Make your way. Slowly take your time. Walk all the way to the top. Once you reach the top, bend your knees. Grab hold of both your elbows and slowly sway from one side to the other. Let your head, you're grabbing it like this, and your head has to hang loose. There is absolutely no tension there. So this is called the rag doll. We're here for 3, 2, and 1. Slowly release. Round your back and slowly rise. Take your time getting there. Your time. Until there, reach your hands up. Bring it to your heart center. Right? We'll do some standing stretches now. So bring your hands, we'll start off with a twist. Okay? So hands to your heart center. Inhale, reach up. Big circle all the way up. On the exhale, you're going to twist. Take your left hand forward, your right hand back, your hips shifting to the front. Stay there for 2 and 1. Slowly reach up. And to the other side, bring your right hand in front, left hand behind, and you twist. Hold for 2 and 1. Slowly reach up. On the exhale, you're going to bring your arms to a 90-degree position. This is called a cactus arms. Push your shoulders back. Okay? Neutralize all the hunching that you've done all day. Open it out, look up. Inhale, reach up. Once you reach up, you can maybe hook your thumbs together. We'll do 2 more of that. Okay? Exhale, cactus, open it up. Inhale, lengthen. Last time, exhale, cactus your arms. Stay there. 2 and 1. Hold, and now you turn. Okay? Twist to the right. Twist to the right. Stay. 2. 1. Slowly bring it to center. Twist to the left. Slowly bring it to center. Okay, so from here, take your hands behind, interlace your hands. Again, roll your shoulders, look up at the ceiling. Right? Bend your knees and you fold forward. Fold as much as you can. Let gravity do the work here. Stay here. 5, 4, 3, 2, and 1. Slowly let go of your hands. Place your hands on your thighs. Straighten your leg. Coming to a halfway lift. Spine straight. Strengthening it all up. Squeeze the stomach in. Exhale. Fold forward. 2 more. Inhale. Halfway lift. Spine straight. Exhale. Fold. Last time. Inhale. Halfway lift. Exhale. We drop. Slowly bend your knees and take your hands all the way up. Bring it to your heart center. Alright? Now, we're going to do everything that I told you at the beginning. Alright? Spine lateral flexion, flexion, and extension. Okay? All of it together. So, place your hands together. Okay? Maybe interlace your fingers. Let your index finger alone be up. Your elbows are also together. Now from here, we're going to twist, okay? Turn over to the right side. Okay? This is our twist. And this is going to impact our thoracic region, the upper region. Now slowly turn to face the side and you're having a side bend. Okay? Now you're drawing like a circle with the body. Open. Just go till how much your body will allow you. Get it like a back bend now. You land on the left side. Okay, side bend on the left. And then you turn, twist. Look down. Slowly bring it down. Bring your fold forward. Bring it to center. And release. Let go of your hands. We're going to do this on the other side. Okay, same movement all the way out. So, fingers interlaced, elbows together, slowly round, exhale round, bring it down, crunch it all in. Slowly turn to the twist to the left side, look down, just look down, your hand is always together. Now open, sideways, side bend, yes. Open it up, go back, turn, side bend on the right side, bend as far as you can go. All of us are going to look different and that's okay. Slowly turn, look down, twist. Twist, stay, and bring it up. Slowly release. So focus, lots of work looks easier. Alright, now we'll move on. Because it's a yoga practice, you need to do 1 round of Surya Namaskar. Okay, we'll do 1 round of Surya. So just shift to the front of the mat. We're just going to walk forward. So, yeah, we walk to the front of your blanket. Now bring your hands to your heart center. Tighten everything up, engage it all up. Inhale, reach both your hands up to the ceiling. On the exhale, slowly dive down, fold forward. On the inhale, place your hands on your thighs, coming to a halfway lift, spine straight, number 7. On the exhale, bend your knees, plant your hands on the floor, take both your legs back into a high plank. Remember, in high plank, your shoulder should be over your wrist. You're engaging your back muscles together, engage your inner thighs together. Inhale and exhale. Alright, from here, bring your knees down. Ashtanga Namaskar, chest and chin down. Slowly from here, glide up, Bhujangasana or Cobra. From here, tuck your toes, lift your hips up and back into your downward facing dog. Form like an inverted V position with your body. Stay there. 2 and 1. Slowly look forward, walk or step to the top. Now from here, coming to a halfway lift position, spine straight. Exhale, slowly fold forward. Inhale, reach up. And bring your hands to your heart center. Right? Now, Place your legs as wide. I would like to give you more of the Surya is, but in the interest of time, I'll stop it at that. So bring your legs as wide as your hips, okay? And take your feet out. So basically, your feet is going to point up. Bring your hands to your heart center, and you're going to sit down. This is called the Malasana. Yes, sit down. Stay here. Use your hands to try and open your knees out. You'll feel it behind in your hips. Stay there. 5. Remember, all the body parts are interrelated. So you cannot isolate one bit. We try a lot to isolate, but you'll have to work the muscles above and below that specific region. Stay here. Here for another 3. 2. And 1. Slowly release. Take your legs forward. Place your legs in front. Now, we're just going to flex and point the toes. Okay? Flexing means you're just going to bring your legs towards you. Point means you're going to take it away from you. Okay? Just the feet alone. Flex and point. One last time. Flex it. Feel that entire chain of the leg move. Stretch when you flex it. And point. Slowly, place it to neutral. Walk your hands forward. Paschimottanasana. Getting like a beautiful stretch in the entire back region. Just go as far as you can go. Okay? Pull forward, look down, surrender. Let gravity do the work here. All you have to do is pull the posture and breathe. Here, 5. 4. 3. 2. 1. Slowly walk it back. Right. Now shift forward so that your heel is on the floor. Just the heel is on the floor because you're going to lie down. Okay, and if you're doing it along with me, and once you lie down, also ensure that you're able to see me. Just adjust your screen accordingly. Okay, take your hands forward, round your back, going down. 5, 4, 3, 2, and slowly lie down. Down. Right. We'll do one round of strengthening for the lower back as well. So what I would like you to do is take both your legs up to a 90. Okay? 90 at the knees. Take both your hands up. Imagine you're doing this tabletop on the ceiling. Right? Okay, here it's called the dead bug pose. So your back is going to lift up. Okay? Try and round your back and bring your back on the floor. That entire spine on the floor. Hold for 3, 2, and 1. I'm going to teach you in stages. This is for strengthening the core. So you're going to tap your left feet to the floor and lift up. Right feet to the floor, lift it back up. Left, up, right, up. One last time. Left and up. Right and up around your back. Stay in position. Hold for 3, 2, and 1. Now, if you want to increase the intensity of the stretch of the the activity, just take your knees away from you. Knees still parallel to the floor. Shift away, and you will feel a lot more on the lower back. Right? And we go 3 more times. Left, up, right, up. Left, up, right, up. Last one, left, up, right, and up. Breathe in, stay. Stay for 3, 2, 1. You can do only this. The next step is that you're going to use your hands and your legs. So your left leg is going to go straight, your right hand straight. Bring it in, right leg, left hand. Bring it in, left leg, right hand. In, one last time, right leg, left hand, and in, release. Let it go, let it go. I hope you felt the burn. All right, now slowly hug both your knees. Round your back, hug it in. Just rock from side to side. Your lower back, nice release. Let it all go. Here for 3, 2, and 1. Hug your right knee, really tight. Okay, imagine you've met like a long lost friend. Hug him or her really tight. Extend the left leg straight. Then breathe. We're here for 3, 2, and 1. Slowly hug on to your left knee now. Release the right leg flat down. Hug it in and stay. 3, 2, and 1. Slowly release. Okay. Now just take both your legs up at the ceiling. Okay. You can do it without your hands, or if you want support, you can just hold on to the back side of your leg. Okay, now we're going to flex and point. Just bring the feet towards you, getting like a nice stretch in the entire back of the leg, and point it towards the ceiling. Flex and point. Last time, flex and point. This posture is called Viparita Karni or legs up the wall. You can just do this against the wall, and maybe when you have your periods or anything, this will be such a relieving posture. Okay, stay here one last time. Now bring both your knees to a 90, and place your knees on the right side. Place it on the right side. Place both your knees on the right side. Place your right hand on the knees. Extend the left hand straight on the left, and you're going to look to the left. Okay? Knees on the right, hand on the left, you're going to look towards the left. Twist. Twist and stay. 5, 4, 3, 2, and 1. Slowly bring your legs to the center, bring it to a 90, and now place both your knees on the left side. Place your left hand on your knee, maybe massage it also if you feel like it. Extend your right hand on the right side, look to the right. Twist, surrender, close your eyes maybe. There's nothing complex from here. So stay. 5, 4, 3, 2, and 1. Now is the most important asana. You're going to lie down on the floor, Shavasana. So just lie down flat. Okay? Lie down. Lie down. Lie down. Lie down on the floor. Yeah. Shavasana is super critical. So spread your legs wide. Okay? Spread your legs wide. Let your heels be in, let your toes fall out. Okay? Place your hands on the floor by your side, palms facing the ceiling. Close your eyes and just stay. Let every part of your body kind of relax. Give permission to every muscle to release and relax. Let it all go. One of the most important things that you can do for your body is give it sufficient rest. So use this time, let everything go, let no thoughts come to your mind. Just you and your beautiful practice that has come to an end. Just lie down. Stay. The next 5 minutes, I'll prompt you when the time is up, okay? Just for the next 5 minutes. Stay there. Very slowly, move your hands and feet. Take your time. Gently bring in some movements in the body. When you're ready, roll over to any one side. Slowly rise up to seated position. Slowly, take your time, there is no hurry. When you rise up, gently bring both your hands to your heart center. Take your time. Only when you come up, bring both your hands to your heart center. Rub them in till you feel that warmth rising on your hands. When you do, gently close your eyes all over your face. Thank you all for joining. I hope you all did it along with me. All of you had your videos up, but I sincerely hope you did it along with me. And there are a bunch of things that you can do to mobilize and bring in more flexibility to your parts. Our body is meant for movement. Our joints are meant for movement. Every one of it is meant for movement. So just try and move as much as possible, and that way itself you can avoid most of the injuries that you might get in our day-to-day routine. So you have a bunch of awesome stuff online that you can look up for mobility, and you can do that. So yeah, if you have any questions again, please feel free to ask. We have like a couple of minutes left. Ram, there is one person who has asked a question.
Yeah, can you please share some tips for people who work from home? Yeah, so as we discussed during the session, they should always consider proper posture while working in the desktop job, and they need to take up frequent breaks. They need to stretch regularly. They need to stretch their neck, stretch their back regularly, and also regular exercise, jogging, walking, yoga sessions should be done like weekly 4 or 5 times. And then they should also maintain their food balance. They should take adequate calcium and vitamin D supplements, I mean foods. So that will help for people who work from home.
Great. I guess, yeah, there are no other questions. Answered everything that came.
You can always drop me an email, tulevi@gmail.com, if you have any questions.
Thank you. Hope you guys found it useful.
Yep. Thank you guys for your time. Thank you, Suji. That was a great session. Hope everybody would get benefit from this session. So moving forward, we'll do a lot more sessions like this.
All right. Thank you, guys. Thanks all of you for sparing your time and staying with us for 1.5 hours in a week. And that's a big thing. So thank you all. Hope it's beneficial. And if you have any questions, we will drop you an email like Ram said with a snapshot of what we taught today. And if you have any questions, you can feel free to reach out to us. We'll also share our coordinates and you can reach out to any of us for any clarifications from them. Okay? We'll wrap it up here. Yes, Ram, anything else from your end?
No, I think we can wind up.
Thank you. Bye-bye.
Thank you. Bye bye. Thank you.